Good morning. My name is Jason Juan Rodriguez. I'm the online admissions coordinator here at the University School of Public Health. Thanks for joining us today. Today we're coming to you from the University School of Public Health in Ann Arbor, Michigan. And I'm joined today by two current master's students, Tiana Morgan and Alex Fox. Thanks for joining us today. Tiana and Alex are both residential students who take classes here in Ann Arbor. We won't have our first incoming class of online students until fall 2019. And we hope maybe in the future you'll be joining us on this side of the camera. We're here to chat a little bit about the reasons that students decide to pursue a Master of Public Health degree, or MPH as we call it, and where the degree from the University of Michigan School of Public Health can take you. So as a reminder, if you have any questions during our time here for Tiana, Alex, and I, please go ahead, put them in the comment section, and we'll try to answer as many as we can. If we can't get to it, we'll be sure to follow up and get you the answers that you're seeking. So let's jump into it.
Great.
When we were kind of first designing the program, one of the communities we had in mind were folks who are in the workforce already and working full time. And so for most of those folks, they've been out of school for a bit and they're thinking about pursuing a public health degree, and there's that tension of what does it look like going back to school after having been removed for several years.
Mm-hmm.
You both were working for some time before returning to pursue a master's degree. Can you talk a little bit about what your career paths were, about kind of how you wrestled that tension of whether to return or not, and then what made you ultimately decide to pursue a public health degree?
Sure. Yeah, so for me, I worked 10 years off and on for the California Department of Healthcare Services, which is California's Medicaid agency. And that was during my time in undergrad, but as well as jumping into a full-time role for 5 years after I graduated undergrad. And in that capacity, I helped run one of the state's waiver programs. And my decision as far as coming back to school after being in the workforce for so many years, it was definitely something that I had to heavily consider. Leaving a steady job, steady income, benefits, the whole nine. I think that it was kind of coming from a position of courage, being able to take that step and step out of the workforce. And the reason why I chose a residential program versus an online program was just because of my personal learning style. I preferred to be in the classroom. I needed to be engaged in that way. And I actually was on a law school path before coming back to public health. Okay. And so that was something that my mentor, who then became my boss, posed to me as far as, have you thought about public health? You enjoy serving vulnerable populations, and you keep coming back to work here. So it kind of made sense after I had considered it and decided to jump in.
Yeah, so for me, kind of similar path to Tiana. I didn't spend quite as much time in the workforce before coming back for a residential master's. I graduated from Michigan in 2015 with a degree in music performance. Go Blue for anyone out there. And I decided to spend about 3 years in fundraising, and I had a boss who later became a mentor who had taken a job over here at Public Health, and she really opened my eyes to the possibility of what a public health degree could do for me. And I was always thinking, because I'm a very analytical mind, that maybe a business type degree would work for me. And it turned out that what I really cared about was not business in general, but actually developing healthier populations and finding ways through financial and organizational means to create healthier populations. So that's what I really work for. And for me, similar to Tiana, I was thinking residential just because that fits my learning style. I really like to dive deep into my learning, and doing two things at once doesn't always suit that for me, but very excited to be here.
And of course, we didn't have the online program.
Exactly.
So, we just had no choice. So what made you select the University of Michigan? There are a lot of public schools out there. Why UMich?
Yeah, so my choice to come to Michigan, in addition to just wanting to have an adventure, get out, experience a new region for the first time, that was part of my decision. But more than anything, of all of the schools that I was considering, Michigan, without a doubt, stood out as far as its community, its collaborative style, rather, among both faculty, staff, and students. I noticed from the first day that I came onto campus for visit day that, it almost felt small to me. Like I was able to speak to our department chair about baseball, his brewery, and public health all at the same time, and that was something that I really loved. Is that it was I knew that there was a rigorous education, it being one of the top programs in the country, but also that there's something more relaxed and natural about it, that I was able to feel comfortable and not feel like I was in any sort of I don't know, I guess what word I'm looking for, but I guess competition with others.
Yeah.
And so it just felt really homey. And I that was something that really stood out to me. I don't know about you, Alex.
Yeah,
but
that definitely sticks out for me as well.
yeah. So that's why I chose Michigan.
Okay.
Yeah, I think for me, having been here as an undergrad and then worked at the university for 3 years, I really knew the place pretty well. And so there was a degree of comfort there. I also know very well, like Tiana was mentioning, this place is absolutely home in many ways, and it has a really great way of what I call embracing the individual. So when you're in the School of Public Health, we're not a massive unit on campus. We're not the same size as some of the undergraduate units, and so what that allows for us is a degree of individualization, but also you're at one of the world's greatest public research universities, and you have all the resources in the world if you need research, guidance, advising, all that is here, but you can also really pursue your own passions.
Right.
For those joining us, I also just want to point out what's exciting about the program is the same faculty and staff that supported you during your program are going to be the same faculty that are teaching the online classes as well, which I think is really exciting and unique, and I think shows the investment that the school's trying to do. Some institutions have like side folks that they hire for that, but the whole purpose of this isn't to have this separate version, but to just kind of extend the reach of the university. So just for those who are wondering, you would have the same faculty. So you talked a little bit about some of them, but what public health issues are you passionate about?
Yeah, so for me, I am incredibly passionate about serving vulnerable populations, working for California's Medicaid agency, and crafting policy to improve population health for underserved populations was something that I really cultivated a strong passion for. And that's something that I seek to do, as I graduate in a couple of weeks. I hope to continue that in the community. So serving the community, serving vulnerable populations is kind of where it's at for me.
Yeah, for me, I would say from like a clinical interest, if I'm thinking psychiatry, if I wanted to be an administrator at a department level, but also for me, it's the patient experience and the way that patient experience and finance play together so closely. I've learned a lot this year, in my first year as a School of Public Health student, about what it means to have cost-effective measures that also deliver on a better patient experience, and that matters a lot to me. So I think a lot about that, and that's what I'll be doing this summer on my internship as well.
So going with that, what skills has this degree helped you refine or acquire towards that end?
Yeah, I think Alex just touched on some of it. I think that the program has done a tremendous job of really being able to paint a picture of how it all comes together. So, we are in a particular degree track, but that doesn't preclude us from taking coursework elsewhere, so we can understand different perspectives of how things come together in a collaborative way to better suit the patient and the community. And so I think that that's something that I've just gained just a huge understanding of. I had very nuanced experience and understanding of Medicaid policy, but being able to understand financial implications, how hospitals are funded, the economics of healthcare and health delivery, being able to understand nuance of insurance and how insurance works to serve populations, but how that also works on the other end for hospitals and providers. So it's been just such a robust scope of how it all comes together to improve population health.
And for me, it's the exact opposite. So I come at things from the point of view of someone who's worked in an institution in gift finance and really understanding the way money moves around in large organizations. But here I've been able to really latch on to some of the policy implications, what it means when money doesn't flow down correctly, when something gets stuck. What is discretionary funding, both at a government level and then also at an institutional level?
Right.
And then also to Tiana's point, I'm taking a class right now at the law school on writing.
Yes.
Yeah.
And these are things that you only get to do at Michigan. And I think that's really what's setting this apart from my other opportunities.
Yeah, and I think I would add to that one thing that I really appreciated, and I'm not sure if the online program offers it. I guess it would be dependent on some of the faculty members that are going to be teaching coursework, because they teach across schools. So some of the faculty here that teach at the School of Public Health also teach at the School of Public Policy.
Yeah.
So you really kind of can build out this robust understanding from different perspectives, which is really special.
Yeah, for sure. And that's the aim. So we're trying to kind of bring it all together. Like these are all the things that influence public health. Because I think that's part of the thing when you're looking at public health. It's just like, what is it? And some people don't realize how far-reaching public health actually is. So you've talked a little bit about it, but if you could just share with us a little bit more after graduation, where does your career path take you next?
Yeah, so I actually was just offered a job at Henry Ford Health System as their health policy advisor.
That's awesome.
Thank you. So that's brand new news. So I will be moving into Detroit to help inform all of the regulatory and legislative policy work and help the lobbyists at the hospital kind of work in the right ways to make sure that policy is working for the hospital and the populations that are served at Henry Ford Health System. So that's what I'll be doing.
I love how you just said that like it was no big deal. By the by.
So I'm since I'm a first year, I'll be taking my internship this summer at Emory Healthcare in Atlanta,
Okay.
and I'm working on lean process implementation across our entire system. So that it's really a staff focused understanding staff culture and bringing them into the patient care flow and making them more empowered and more ready for the complex challenges that they face. Emory is in a pretty unique situation, being so close to the Centers for Disease Control and Prevention, and then also they have many community partners that rely very heavily on their care. So the high acuity of patients that they see, lean process improvement is super important for them. So I'll be doing that this summer, and then down the road, really looking at staying in the hospital setting and either in patient experience or in finance, and really narrowing down that focus.
Awesome. So we don't have any questions just yet, but before we get into logistics, is there anything that we didn't touch on or that you would want them to know or that you think is worth kind of thinking about as some folks are kind of thinking about whether or not to make this big adventure? Because I mean, that's what it is.
It's a huge step.
Yeah.
Yeah, I think for me, the thing that really has been a guiding light is stay true to yourself. What do you want? And really think about where you want to be, not only in 2 years when you're done with your degree, but then 5 years, 10 years down the road. What's going to set you up to get on that career path? And if you think that, an online program is for you, then it probably is.
Yeah. I would echo everything Alex said, and I think for me, one of the things that I noticed being in the role that I was prior to coming back to school, I was the only one on my team without a master's degree or above. So I knew, in addition to it being a personal goal of mine to pursue a master's, I knew that if I wanted to continue to grow into certain roles to affect broad-scale population health change from a policy perspective, having that master's degree was really going to help me get there, kind of to the point that Alex was making when where do I see myself 3, 5, 10 years down the line, and what would be potential hindrances to me getting there. And to me, I felt having a degree would only help me along the way. So that was part of my decision making.
Awesome. We do have a question that just came in.
Great.
Will the online courses be live streamed or pre-recorded lectures? If it's okay, I'll take that one.
Yes,
Please.
It's going to be a mixture of both, actually. So there'll be pre-recorded lectures, and then once we have the cohort and the class is filled, the faculty will work with the students in the class to figure out a time that works best for everyone for about an hour or so to meet as a cohort and to, build the community, because sometimes, the online can feel distance, but what we're trying to do is show that it doesn't have to be that way, and you can have
That's great.
as similar of an experience as possible in terms of building community and support. So it's going to be both, and how that'll play out, will depend on everyone's schedule.
I have one thing to add
Yeah.
that I just thought of that sets Michigan apart from anywhere else that these students would also have access to, and it's the alumni base.
Yeah.
I think that that's something that
Yes.
is so important. And I remember when I was on the other side of the camera, tuning into things like this, trying to make my decision, and everybody talked about Michigan Mafia, the alumni base, and I was like, what the heck is that? And does it really matter? Like,
Yeah.
is there leverage there? And it is absolutely unmatched, the alumni base. They are so accessible. They are broad reaching. They are represented across the world. And I mean, I kid you not when I say I want to have an informational interview with somebody that I may want to learn a little bit more about the area of work that they do. Send one email note and they're like, absolutely, let's hop on a call. And that's something that is so special in just kind of complementing the education that we're getting in the classroom, being able to think through, and you mentioned it earlier, how broad public health is and where you can plug in as far as careers, being able to explore that through our alumni and how they've applied their education to the work that they do in different capacities has been incredible.
Yeah, and I would say, to Tiana's point, the Block M travels everywhere.
Yeah.
I've been in the airport in Chicago at O'Hare, and I get a Go Blue. I've been on a side of a mountain in Montana. If I'm wearing something in Michigan, I'm getting a Go Blue. Whether or not people went to Michigan, they recognize the power of a Michigan degree and what it can do for you, and I think that's not something that you find everywhere.
Right.
Nice. So let's give folks a little bit more time to think of questions and ask them. And so we'll jump to some of the logistics in terms of application requirements. There's still time to meet the April 30th second priority deadline. What that does is it just, spaces are filling up fast, and we are working and having some limited scholarships available. So getting your application in by that time is going to give you the best opportunity for the consideration for that. There's nothing additional you have to do for the scholarships. We'll automatically, whatever we can give that you're eligible for, we'll try to be like Oprah, you get a scholarship, you get a scholarship, as much as possible. So what you'll want to do is you'll want to fill out your SOFIS application. You'll want to submit through the application itself your transcripts. You're going to provide a statement of purpose, which is about 1,500 words, and a reflective essay, which is about 500 words. Resume and cover letter, 3 letters of recommendation, and then the dreaded GRE or MCAT. I will say, though, we are doing something that for folks who have accredited doctoral degree, they can have the GRE MCAT requirements waived.
Oh, that's great.
Which also works out because sometimes folks who have that degree who have been working had it a long time ago.
Yes.
And unfortunately, those scores do expire.
Oh, yeah.
So I would just make a point to mention for the essays, my only tip is to, and you've both talked about it before, be authentic to who you are. The best way for the folks who are a part of the admissions community to meet you is to present who you are as much as possible in those essays. So really use them. That's your space to show up. So be bold and do that. The important dates you should keep in mind is April 30th, like I said, the next priority deadline. And then the final deadline for all applications is June 1st. After that, it will be closing, and then you'll have to wait to fall 2020 for the next cohort. And classes will begin in September.
Yeah, and I would say the one thing that I really remember from writing applications, and it's also true in cover letters and resumes, is try to weave in a narrative. I think that's super important.
Yeah.
Rather than just stating a bunch of facts about you, which may also be true, connect them through a nice narrative. And I think that's always something that when I'm talking about myself in person or on paper, I really want to make sure that's coming through.
Yeah, and I think as far as the letters of recommendation, I was very strategic in who I sought out to write those letters. For those of you who would be joining, leaving the workforce, I mean, you have colleagues, you have bosses that may know you and your work ethic really well. Somebody that can speak to both your personality and your work ethic would be a bonus. But being really strategic in that, and not just finding a distant professor that was from years ago that may or may not remember who you are. So being strategic in those, I think, is really important.
Yeah, it's definitely better to have a recommendation from someone who knows you really well than someone who has this awesome credential who you might have run into 2 or 3 times during the course of your work.
It's like, I had this person in one class 10 years ago.
Exactly.
They did well. Yeah.
Right.
Yeah, that's not nearly as strong of a recommendation as someone who sees you every day.
Totally.
So that actually, I think, goes really well. So the question was, is there a preference for number of academic references versus professional references? I think that's going to be contextual based on where folks are coming from.
So I had 2 professional and then 1 academic, because I think you have to have at least 1 academic.
Right, and I definitely wanted to make sure I had 1 academic, but I felt that the majority of like my candidacy was based on my work experience.
Totally.
So I definitely, I had actually 1 was professional, 1 was through a volunteer.
Oh, great.
Because I'd done some volunteer work here at Michigan Medicine with the Department of Psychiatry, so I was able to leverage that into a really meaningful recommendation as well.
Yeah, and like we said, the biggest thing is you want folks who can speak to you and who can help kind of build off the narrative you created for the admissions committee to get to know you and get excited about you and kind of see you in the program.
Exactly.
Listen to what they're saying. We don't have any further questions, so some might come up later. Don't worry about it if you didn't get it in now. We'll keep following up with them. But in the meantime, thank you so much for taking time out of your busy schedule.
Thank you.
Super excited for what y'all are going to do. You're just about out of here.
It's crazy. I know, 2 years flies.
Thanks to everyone for joining us and asking questions. Continue to submit. We'll answer them. And then just remember that there are a host of ways to stay connected to us through online. Go to coursera.org, sphumish.edu/online. And then we're all over the place with social media, so just pick one and go for it. And otherwise, we'd just like to thank you for your interest in the University of Michigan School of Public Health and for your time today. And as Alex said, go blue.
And good luck.
Good luck, yeah.
Good luck.